The vast majority of low back pain is horribly disruptive in your life and can be very sore and debilitating without there being anything sinister going on. Fear, worry, misinformation from health professionals, etc. can mean it lingers for longer than it should. But sometimes back pain is sinister. Here's what we will discuss in this video. How can you tell if this is a sinister pathology that needs immediate attention? My name is Tommy Brennan. I'm the owner of the Pain and Performance Clinic in Dublin. Please like and subscribe for evidence-based practical advice to keep you active and pain-free. Sinister cases involve less than 1% of people with back pain. But of course, these things must be ruled out. Let's start with what is considered sinister. Cancer, cauda equina syndrome, infection or fracture. So as I've said, most low back pain is not sinister, even though it's incredibly sore, and the approach needed starts with making sense of your pain and starting to move freely again. But for that to happen, we need to be certain nothing sinister is going on. We will go through this in some detail. MRI scans and physical examinations in these instances aren't nearly as useful or important as your medical history. And don't worry, pain severity or pain duration aren't the key factors here at all either. For example, if you've had back pain for 4 years that comes and goes every few weeks, leaving you debilitated for a few weeks at a time, then it's definitely not a sinister pathology. And what happens if it is sinister? It means that further investigation is needed. It's a bit of a minefield. I've tried to make this as clear as possible without causing undue panic. Let's start here. So if there's an incident or accident, a strong enough trauma for there to be a potential fracture of your spine, then please go to the hospital immediately and request an X-ray. In this case, a fracture needs to be ruled out. Secondly, if you have pain and weakness in both legs and it's hard to pee, again, go straight to the hospital immediately. A lot of the time, it's not as dramatic or as clear as the instances above. As a starting point, these 3 conditions need to be met. 1, pain that has been bothering you for more than 6 weeks. 2, pain that is trending in the wrong direction. It's very severe and or getting worse. And 3, there is at least one other red flag, which are listed here. Red flags is the name given to signs and symptoms in a person's medical history that might indicate that a serious pathology exists. Red flags aren't reliable. Having them doesn't mean that you have a serious spinal pathology, and not having them doesn't mean that you don't have a serious spinal pathology. While they do not mean that you have a serious spinal pathology, they do raise suspicion and are used by healthcare professionals to guide the most appropriate clinical pathway. However, guidelines aren't always clear and there is confusion and inconsistency in their identity and relevancy. As an example, 163 red flags have been identified in spinal pathology. This higher number obviously presents a challenge in daily clinical practice. Also, very few red flags in isolation are informative. They are most useful when used in combination with a comprehensive patient examination, especially their medical history. So remember, sometimes there are false alarms, but here are indicators in someone's medical history that raise a red flag. Age under 18 and over 50. History of cancer. Unremitting pain, no position of ease including lying down. A major trauma or a minor trauma in the elderly. Fever, chills, night sweats, and generally feeling unwell. Unexplained weight loss. 5 to 10% of body weight over a 3 to 6 month period. Bladder or bowel disturbance, numbness, loss of sensation in the groin, buttock and genital area, numbness and or tingling, weakness into both legs. It's unfortunate to have to mention cancer when it comes to back pain. It's extremely rare, but it can happen and can be extremely hard to diagnose. History of cancers that have a bias towards spreading to bone, like breast, prostate, lung, kidney, and thyroid, should raise higher suspicion. It can often be gradual and not very painful. The very sore, disruptive forms of low back pain are often the least threatening. If you're worried about having a sinister back pathology after looking at this video, please contact your GP, or if you are clear from this that you have annoying, disruptive low back pain, please feel free to comment below with your questions or comments, and we'll be glad to help.